Hi, I'm Nicole. I'm a doctor of physical therapy and associate director of clinical excellence here at Kaya Health. In today's presentation of Step Strong, we'll be doing a high-level overview of our feet and ankles, common pain, symptoms, or experiences you might have in your foot and ankle, as well as how Kaya Health can help. Our feet are made up of over 26 bones, 20 muscles, ligaments, and 3 arches. We have a longer, more supportive arch on the middle of the foot that runs from the heel to the ball of the foot. We have a more structurally sound arch on the outside of the foot that also runs from the heel to the ball of the foot. And we have a shorter lateral arch that runs from the middle to the outside of the foot. The arches are made of thicker tissue and some muscles that help support us and work together with our muscles and joints for things like shock absorption. So think about walking on a really sturdy surface, such as concrete or pavement. Every time you take a step, our arch helps to translate that shock and force up the leg to the pelvis and back. They also help support our body weight, maintain our balance, and in general, keep us mobile and moving so we can do the things we need to do and want to do. Some common complaints most people experience have to do with 2 different things. One is arch structure. So the more common term is called flat feet or pes planus. This is when the arch is somewhat low or even collapsed, where it's touching the floor. Some people are born with this. Some people experience it just generally over time as we age. But it can feel and make you feel like you're sore or tired in your feet with prolonged activities, such as walking, standing, running, walking upstairs. And then the opposite might be in people who have high arches. So the arch, the tissue that makes up our arch that runs from the heel to the ball of the foot might be tighter, pulling and tugging a bit on the bones, making them feel sore or painful. Because of that pressure, it might cause someone to walk or move a little bit differently. So they're avoiding the pressure point. And that can ultimately put you at a greater risk of injury in things like your ankle or your shin or your knee because you're avoiding those pressure points and pain. The more common foot injury that 10% of our population experiences is called plantar fasciitis. This is generally described as a sharp or stabbing pain in the heel, and most commonly experienced taking your first few steps in the morning or your first few steps after you've been sitting for a while. So if you're sitting and working and doing something for a few hours at a time and you stand up and feel sharp stabbing pain in your heel, that could be indicating that it's plantar fasciitis. Plantar fasciitis is inflammation of the plantar fascia, which is a tissue that makes up most of our arch. It can come on from repetitive movements, overuse, or if you have a lower arch, so it's tugging and pulling a bit on the bone. And it can be triggered by prolonged positions, such as standing or walking, poor footwear, so it might be that you just need to change your shoe or get a more cushioned heel or more supportive arch. And some people experience this because they have limited ankle mobility. So they're not as flexible in their feet and ankles as they should be, causing pain in the plantar fascia. And then lastly, due to high repetition jobs or positions that require you to be on your feet for a while, you can develop things called stress fractures, which are tiny cracks in the bones caused by the overuse. This may create some swelling, tenderness, and pain over the area that worsens with the movement that's causing the stress fracture. So, what can you do to address some of these symptoms or impairments or even prevent them from happening? Well, Kaya Health is a benefit to you at no cost. We have an excellent foot and ankle program that introduces various exercises, such as stretching exercises for your feet, ankles, and calves, strengthening exercises for your foot and ankle that include small muscles in your feet that you may not even know you have. And we offer education and support. Our education helps guide you on proper footwear, things to do or not to do, how to support yourself if you're experiencing pain. And we also have dedicated health coaches at Kaya to help guide you and set goals. If you have additional questions, they can relay them to the clinical team for additional support, but we're here to help. And if you don't have foot and ankle pain, we will help prevent it. We want to educate and provide you with the right tools so if you start to experience any of the things described, you can help stop it before it gets worse. I hope this was informative. Below there's a QR code to help you get started today. Again, this is at no cost to you. It's only here to help you, and I hope you enjoy it.